Okay, I got some tape in my car.
I am Dr. Keisha Callins. I'm an OB-GYN, and currently I'm working in two of my offices, which is in Gray, Georgia. I have the benefit, I think, of serving also in Jeffersonville, which is in Twiggs County, and that's definitely rural. There's just not much there. We have like a blinking light, not a stoplight. It's that small. Now that people know that there's an OB-GYN that's here, that's accessible, I think that's helping somewhat, because a lot of the kids that I'm seeing, or the young girls, their moms are my patient, and so then it kind of carries over. So I think that's one of the benefits of really being in a somewhat rural or underserved community, because once you're there and you start establishing relationships, then it's almost like building a family practice. It's not uncommon for me to see the mom, the daughter, the grandma, the auntie, the neighbor. It just extends out. So relationships happen on several levels. There's definitely the patient relationship, and then there's like the professional relationship where you're meeting people in the community, and that's not just medical. I mean, I'm talking about being able to know, the person who works in the post office, the person at the supermarket, that level as well. And then it goes up to kind of include just the other entities, like the churches, the courthouse, like being able to intersect with the bank and things of that sort. And so really, relationships, especially in a rural community, are very key. You're going to find out about things maybe before they would normally come to light. And particularly when it comes to women's health, women are the center of the family. If mama's good, if grandma is good, everybody's great. And so the goal with women's health is to really focus on that female who's usually the center of the family. And sometimes that's physical, sometimes that's emotional. But being able to be in a position where you can be comfortable addressing those things makes a big difference.
Miss Hart? Hey, I'm Dr. Callins. Long time no see. How are you?
I had to come check on you because nothing's really working good.
Okay, so
the other hard thing about medicine sometimes is realizing someone has a problem and then helping them to understand that it's a problem, and then getting towards fixing that. That can be challenging sometimes because you're telling people things that they don't want to hear.
chips is a problem. And honestly, so it's kind of funny. So you're telling me you're taking cholesterol medicine, but if you're eating chips like I think you're eating, you're not really helping yourself, right?
Okay.
So
I didn't know that.
I know, but now we know. When we know better, we do better, right? So
Being in a rural community, you don't necessarily have to be the person doing everything, but you become a gatekeeper or maybe a bridge, because you're able to expedite the care in a way that would not normally happen if the patient did not have your advocacy on board.
she has a thyroid issue that's being managed by her primary, so we need to follow up on that. Our list is getting long, so. Ma'am.
Just Miyaka.
Hey Miyaka, it's Dr. Callins. How are you?
Hey, I'm good. How are you, Dr.
Good.
Callins?
I'm just checking to see if there's any luck with getting that appointment for my patient.
Hey,
Hi,
I need a favor. How are you doing up there?
I'm good.
My contribution is not in doing everything for everyone. It's getting them where they need to be quickly based on the acuity of what's going on. And unfortunately what happens is when people think about working in a rural community, it can seem terrifying, because if you are the only one, then what if you get into a bind? Like, what do you do? Well, you build a network. You got to pick up the phone and call someone and say, hey, I'm not really sure about this. Your scope of influence really is stronger if you connect to other entities. There's never a case that comes in where I can't help, because even if I can't do it, I need to find somebody who can do it so they can get what they need.